at the grand opening of the new Centralized Pre-Admission Testing, or otherwise known as PAT, department here in Hollandale Beach. You can see there's rows of cubicles here, 25 cubicles. This is a big department, but they have a big job to fill. I can vouch for the need of this department as I witnessed firsthand last night, a phone call by one of the nurses, the last call of the night. It was 6 o'clock at night, and an elderly woman who had lost her husband and had 101 questions, and this nurse did it with such grace and expertise and most of all patience and caring, and it was very exciting and impressive to witness.
Pre-admission testing is the process that we use before surgery to assess the patients and make sure that they're stable for surgery and healthy for surgery. It helps reduce cancellations and helps improve patient safety by making sure the patients have the appropriate labs done and all the other clinical tests that they need so that they're ready to go into surgery at one of our 6 facilities.
As a pre-admission testing nurse, we make sure that each and every patient is safely and efficiently prepared for surgery. We make sure that we update their medical history, that we have all the clearances that we need, and that the surgeons are aware of any issues that we come across in our preparation of the patient. We work hand in hand with anesthesia. We follow their guidelines, and we make sure that on the morning of surgery, you as a patient, you have everything that you need and you're complete, ready to go for surgery.
We understand that if we standardize around leading practices for safety and quality, that the outcomes for our patients are going to be what we want and what they need and deserve. So I've had the pleasure of working with the leadership, collaborating with the medical staff, our Director of Medical Affairs at Memorial Pembroke, Dr. Dexter Sereda, Dr. Adam Blumberg from our anesthesia department, as well as Dr. Amy Polito and their staff, to be able to collaborate and create a process that is going to create the best experience for our patients and their family members so that they're confident coming into their procedures, as well as to reduce the opportunity to create harm for a patient that does exist in healthcare today. We want to mitigate the risk by adequately assessing and preparing our patients undergoing surgery long before they undergo that surgery.
I think it helps all the patients across the system. It allows us to treat patients with the same problems in the same manner from hospital to hospital. We did find that there was a lot of variation in how these patients were evaluated at different hospitals. So I think overall this will improve their care and also improve their patient experience going through the process.
I think this is a great step forward for the healthcare system in general from healthcare. Whether you're having surgery on the west side of town or the east side of town, our patients in our community should have the same care. They should be able to have the same best practices wherever they're having their procedure. We should be able to continue to work together, and I think by standardizing our leading best practices of pre-admission testing, we're able to really drive home the point of best practice medicine and evidence-based care.
Safety is number one priority for the Memorial Healthcare System, so we wanted to ensure we are doing the correct thing for our patients as customers, to making everything safe for them.
So why is standardizing pre-admission testing important to our customers, our patients, as well as the business?
Okay, with standardizing the process is really taking those best practices that exist out there, implementing throughout our departments, so we can, deliver a better, kind of patient safety and improve patient satisfaction.
It reduces our variation. We were all doing something a little bit different, and we took the best practices from each of the facilities and standardized them. This is good for our patients as well as our surgeons. They know the outcomes and the results, and also for efficiencies. We took the best practices and we standardized them for efficiency, safety, and quality.